Hello people, this is Dr. Muskaan this side, and today I am going to discuss one case with you. Let me take you towards journey of this case. Here is 71-year-old male who has came to ER with complaints of fever since 10 days and shortness of breath since 1 hour. On arrival, airway was patent, breathing assessment was done, respiratory was 18 per minute, SpO2 was 84% on room air, so desaturation was present. To treat that, we have given 4-liter oxygen or nasal prongs, and SpO2 was maintained was 94%, so that was good. On circulation assessment, pulse rate was 160 per minute and it was persistent, so there was SVT present, that was supraventricular tachycardia, and to treat that we have given injection adenosine 6 mg followed by 12 mg was given, and then amiodarone was given 30 mg for 30 minutes. BP was 124 by 93 mmHg. Sensorium was alert, that was GCS was 15 by 15, E4, V5, M6. HOPI, patient was apparently asymptomatic 10 days back when he developed fever which was on and off in nature, associated with chills, burning, micturition. He also complains of shortness of breath which was sudden on onset. He was not able to go to washroom alone. It is associated with nausea, pain in abdomen, and there was colicky pain. Negative history of fever and vomiting is present. Past history, he is known case of hypertension since 1 year, not on regular medications. He is also known case of type 2 diabetes mellitus. Since 4 years he was on regular medication of metformin 500 mg OD. He is known case of hypothyroidism and he was on medications for that too. He has been admitted to AIMS hospital for 1 day with similar complaint which he has came with today, and at that time NGO, echo, everything was done, but there was no good findings, and he was given the tablets, that was Ecosprin and spironolactone, and there were no other comorbidities present such as TB, epilepsy, seizures, or type 2 diabetes mellitus. Further, this personal history, sleep habits are normal, bowel bladder habits are abnormal, he is having burning, micturition and loose stools, no addictions of smoking and alcohol. He was initially non-vegetarian by diet, but from past 3 years he is on vegetarian diet. General examination of the patient. Patient is lying comfortably on bed. He is oriented to time, place and person. He is conscious and cooperative. Where he has came on 16th of November. Today is 19th of November. I just told you the treatment which was given in the ER. Right now he is in ICU and today he has stable vitals. BP is 117 by 62, pulse rate is 110 per minute, respiratory rate is 25 per minute. SpO2 he is maintaining 95% saturation on room air. Temperature is also good, 98.3 degree Fahrenheit. When he has came to ER on 16th, his temperature was 102 degree Fahrenheit. RBS when he has came was 414 and today RBS is 196 mg per dl, and ICU protocol says that RBS should be maintained between 140 to 180, but today it is 196, which is far better than 414 with which he has came to ER. Pickles, I have seen paralysis, clubbing, cyanosis, lymphadenopathy, edema, and out of these 6 parameters, edema is only present. Further investigation picture of the patient. CBC shows anemia, leukocytosis and thrombocytopenia. KFT shows increased urea and hyponatremia. LFT shows hypoalbuminemia and serum lipase level was increased. Chest X-ray, chest AP view shows consolidation on left side lower lobe. ECG shows atrial flutter. That means there was saw-tooth shaped F wave, that is 3 flutter waves between 2 hour intervals. There was no real P wave for each QRS complex. My patient was highly further investigation part. Sensitive. Why highly sensitive? I will tell you later on. HbA1c was 11.2%. He was diabetic because when it is more than 7% HbA1c, that means the patient is diabetic. USG KUB shows grade 2 prostatomegaly, right renal calculi with mild right hydroureteronephrosis. Ultrasound whole abdomen shows moderate splenomegaly and mild ascites. Procalcitonin level was normal. That shows there was no septic shock. HCV, HIV1, 2, HB, AG, all were non-reactive. Then I saw the Frankenbaum criteria of the heart failure in the patient. There are major criteria and minor criteria. From the major criteria, there are 7 points. In minor criteria, there are 6 points. And in my patient, there were 3 minor criteria was positive and 2 major criteria was positive. And to diagnose the heart failure, we have to see that either two major should be present or one major plus two minor should be present. So my patient falls in the criteria of the heart failure. The positive findings were hepatojugular reflex and JVP, which is major criteria, and ankle edema, dystonia exertion, and tachycardia, which is minor criteria. Further, how my patient is highly sensitive, we see two things, either sensitive or specific. To see the my patient is highly specific, not sensitive. How we see that, there are 3 points in specificity, that is hepatojugular reflex, ascites and rales, which was present in my patient, but not present was orthopnea, PND, S3, which shows highly sensitive, plus hepatojugular reflex and JVP is also there. So stage of heart failure are there, ABCD. In my patient there was stage C, which says that symptoms of heart failure should be present, that is angina, dyspnea and palpitations, and structural disease such as atrial flutter is present. He falls in class 3 of NYHA classification. For the previous examination I have done inspection, there was normal skin color, there was absence of suture, there was absence of dilated inject superficial veins. On inspection of precordium, bulge was present. What is precordium? Precordium is a region of the thorax which is immediately in front or over the heart. Visible pulsation, JVP was positive. Apex beat was present. What is apex beat? Cardiac impulse movement occurring due to the impact of the heart against chest wall during systole. Shape, there was no deformity or bulging. Palpation, any local rise of temperature was absent, tenderness was present. Localized apex beat, yes, it was localized between 4th and 5th rib. Parasternal heave was absent, thrill was absent. What is thrill? Thrill is any sound or movement which is low pitched, which will be palpable like a worm moving around the underhand. These palpable vibrations are called thrill. It is called as palpable murmur also. Further, percussion part of the right border, left border and upper border and lower border was done, and auscultation part in mitral valve, tricuspid valve, aortic area and pulmonary area was done. And I didn't heard any murmur because I am in learning phase right now, truly agreeing to that part. So further, the diagnosis of this patient is heart failure with atrial flutter, with type 2 diabetes mellitus, with hypothyroidism, with hypertension, and that's all. And I really received a kick while learning on this case. Why? Because I have done serious examination, which was a good part. That's all. Dr. Muskaan is signing off now.